Thank you very much indeed. The time now is 8:10, and we're joined for the first time since she got her new job by the Health Secretary, the new Health Secretary, Victoria Atkins. Miss Atkins, good morning.
Good morning.
Thank you so much for joining us. Plenty to discuss, not least the junior doctor strike. But given the strength of our listeners' feelings on not just assisted dying but hospice care, I wondered if, with your kind permission, we could start there. Stephanie, a listener to this programme, we heard from just before 7 o'clock, had a specific question which she wanted to put to you.
It seems silly and just not even realistic to expect hospices to be able to fund all the money that's left. And I would ask the Health Secretary to explain why at the moment so many people who have cancer and need symptomatic control in the wonderful hospices are not being able to access this, and then also having to compete with each other to get a place. And I don't find that very acceptable, to think that there's somebody else as ill as myself who's also trying to get a hospice bed, and we're all trying to get into the same small number of beds.
What would you say to Stephanie, who's listening now?
Well, first of all, I would obviously wish her the very best, and I'm so sorry that she is facing what she's having to face at the moment, and her family as well. In terms of hospice care, they're a really important part of not just our healthcare system, but I think actually our communities. We know, every hospice in our communities up and down the country have a special role, and they're recognised for being wonderful providers of care in those moments where people most need them. And they're part of, I genuinely think actually part of the reason for that standing is because they are so deeply rooted in our communities, staffed by people who live locally, with fundraising, and that's an important part of that. I fully accept that. But also we have now, through integrated care boards, provided money for local authorities and integrated care boards, to put money towards, to invest in palliative care and hospices. And I welcome the fact, actually, that we're having this debate, because I think, we should understand why funding decisions have been made at local level if there are issues with an individual hospice.
Absolutely. So sorry to interrupt. Her question was, why is it that at the moment so many people who have cancer and need symptomatic control in those wonderful hospitals are not able to access this? And so you mentioned the debate. Let's just put three facts out there for the benefit of our listeners. There's been a £47 million real terms cut in funding for hospices, according to the source for that is Hospice UK. The number of people needing end-of-life care is forecast to grow by 25% over the next 25 years. The source for that is Marie Curie, who run hospices. And 1 in 4 families in this country aren't able to access the end-of-life care that they need. That's according to the Association of Palliative Medicine. If you put all of that together with the fact that hospice care in this country is only 1/3 funded by the state and 2/3 funded by charity, that's not really the mark of a civilised society, is it?
Well, in terms of the funding that we provide at national level, in fact, this year there's been an investment of £1.5 billion that we've said to local authorities and ICBs, as I say, into integrated care boards, which are the local boards. Sorry, I'm constantly trying to cut through the jargon of the medical system, but they're the system of care boards where we try and do, as the title suggests, integrate both healthcare and social care. For many of the reasons you've just set out. And so we've given around £1.5 billion to local authorities and integrated care boards for them to spend locally as they feel the needs of local populations require.
But it's still the case that hospices in this country are 1/3 funded by the state. 2/3 of hospice funding in this country comes from charity for the most important days of people's lives when they're dying surrounded by their families. I mean, is that a mark of a civilised society?
Yeah, and we also, this summer, we've announced a further £600 million investment into social care, which will help people who are living or who are both resident in hospices, but also, of course, who are receiving other forms of care, social care as well as adults. So in terms of the funding model as a whole, this is, historically, this is has built up. I think we would like the money that provided at national level to be spent as well as possible.
That's obviously, you obviously want value for the taxpayers' money, but it's just, you're not talking about any fundamental change. As we look ahead, going into an election year, hospices will still be 1/3 funded by the state and 2/3 funded by charities. That's going to be the long-term trend.
So at the moment, on the financial outlook I have before me this morning, as I say, we have invested this £1.5 billion across local authorities and integrated care boards.
Okay, let's move on to assisted dying. 65% of the British public now support legalising assisted dying, according to one, it is just a single poll, but one poll by Ipsos Mori from July the 7th of this year. Shouldn't Parliament be given a free vote